In this high-risk maternity unit,
How you feeling?
A little good, just want it done.
life is about to begin.
Position.
And push. Here now. 1, 2.
For some, it will be touch and go. For others, it will be joy, then relief.
Looks like a girl to me. Here comes the head. Holy cow.
Is he out?
But for all, it will be the most unforgettable experience ever. Watching their babies struggling to breathe, trying to nurse, refusing to give up. They are special deliveries, fighting for life. At Chicago's Prentice Women's Hospital of Northwestern Memorial Hospital,
Feeling your contractions pretty good still or no?
21-year-old DeLeon Bridges was admitted 2 days ago with preterm labor.
We know that you're 34 weeks today, and we're not going to do anything to slow your labor down because we were talking about it, how, you know, you've had a couple of babies early before. There's a reason why you go into labor early. It's hard for us to say sometimes, but what we can say is it's probably better for your baby to be delivered than to stay inside.
She's already at 5 centimeters, but at 34 weeks, her baby may be born with breathing difficulties.
We're going to try to speed things up by breaking your bag of waters. So far, everything looks great. You're doing fine. The baby looks really healthy, but your contractions aren't real regular yet. She is 6, 1.5. Clear fluid, and she's -1. Good. We're all done. There's no going back now. It's time to have a baby today, okay?
This is not DeLeon's first pregnancy.
In 2000, I had my son. I was 34 weeks when I had him. He was 4 pounds, 11 ounces. He had to stay in the hospital for 3 weeks because he wasn't breathing on his own.
2 years later, DeLeon gave birth to a daughter, Jasmine, at 36 weeks. Then, tragedy struck.
I woke up and fed her. 5 minutes later, after I birthed her, I laid on top of me. And I went to turn her over to change her pamper. She wasn't breathing. It was hard. I was in shock at first. She was 22 days old when she passed away.
After the death of her infant daughter, DeLeon got pregnant again, but she miscarried after 4 months. So this time, at 34 weeks, she's especially anxious.
I just have had a couple of minor contractions.
Allison Sirens is being induced today.
I'm gonna examine her and see where we are in labor.
At 33 years of age and having given birth to 2 other children by induction, Allison is a relatively healthy mother-to-be, except for one thing.
Allison has white coat hypertension. You know, whenever I've taken her blood pressure in the office, it's always been high. No, that's 100%. You know what? You are ready for your epidural, girl.
I am?
Yeah.
What am I?
You're like almost 4.
Oh, no.
White coat hypertension is believed to be a phenomenon of environment, a medical environment.
They call it white coat syndrome because when I get my blood pressure taken in a doctor's office, it's higher than it would normally be and is normally. And the way they know that is because I have a machine, too, that I'll calibrate in their office, and then if I take it at home, it's less.
Okay, think low.
Around medical personnel, Allison's readings have reached highs of 170 over 130. But technically, it's not preeclampsia or pregnancy-induced hypertension. There is no protein spillage and no fluid retention. But high blood pressure is high blood pressure.
Okay, think lower.
That's why, they call it the silent killer or whatever. You just don't know sometimes. People that have white coat syndrome tend to, later on in life, sometimes can develop high blood pressure, so I have to watch for it.
Hey there.
Lisa Yore's doctor is concerned.
Not doing real well here.
She isn't due for 7 more weeks.
The doctor just checked you. I want to check you myself, if that's okay.
But she's already in labor.
We need to make a decision as to whether we're going to try and stop the labor or not. Now, you, amazingly enough, do not look like somebody who's in labor.
In most cases, 33 weeks is significantly premature. In Lisa's case, the risk is multiplied by 3.
Our triplets decided to come a little bit earlier than we expected, but they're on their way.
Lisa's triplets are the result of in vitro fertilization.
We're almost at 34 weeks, so I guess for triplets, that's pretty good. We definitely know 2 boys, and then we think a 3rd boy, or we don't know. The 3rd one is kind of a mystery child.
I agree with her. It's almost 5 centimeters dilated. All right, here's the deal. The monitor suggests that even though you don't feel them, you are having some contractions. We're not picking them all up. They may be every 3 minutes, they may be every 6 minutes, but whatever it is, it's probably enough to make you dilate.
Babies born at 33 weeks have underdeveloped lungs. Normally, a 2-dose, 48-hour course of steroids would be given to help the triplets' lungs mature. But Lisa doesn't have 48 hours.
We're going to get the medication up from the pharmacy. Okay. We're going to give it to you. We're going to keep monitoring you, probably check you again in another hour or so.
Okay.
Lisa has also been given medication to slow down her labor. It's a last resort.
If you ask me to give you a percentage, what's the chance that you're still going to be pregnant tomorrow, given the change that's happened since you've got here, I'd say 50-50 at best. But it isn't 0. And so that's why I want to give this a try. All right?
In the next hour, her body will decide if it's time for a special delivery.
Kristen Stewart, I'm here for my amniocentesis.
I'm just gonna do measurements around.
29-year-old Kristen Stewart is expecting her 2nd child.
I'm just gonna scan the baby, and we're gonna do growth on it and make sure the growth is appropriate for its age.
She's 37 weeks pregnant, almost term, but she's here to see if her baby's lungs are mature enough for immediate delivery.
And actually, if you look, see how it's kind of squeezing in and out? Right. Baby's practicing breathing, so that's a good sign.
If his lungs are mature, doctors want to schedule Kristen for a C-section because staying pregnant could kill her.
I've been having blood pressure problems, and I've been hospitalized twice during the past 3 weeks to determine if it is preeclampsia again.
Preeclampsia occurs in 6 to 8% of all pregnancies. Its symptoms are elevated blood pressure, fluid retention, and protein spillage in the urine, which could damage the kidneys.
I don't normally have high blood pressure. It just seems to occur during the 3rd trimester of pregnancy for me.
Kristen's blood pressures have been hovering around 130 over 100, and doctors are concerned that she is at risk for stroke and seizures.
Doing wonderful, just breathe.
The only cure for preeclampsia is delivery of the baby. Kristen's last pregnancy resulted in an emergency C-section, something doctors want to avoid this time around.
That's it.
That's it, you're done.
Okay.
Baby has a nice strong heartbeat.
No, not right now.
Okay.
We're waiting for the results back in a couple of hours to tell us whether the lungs are developed enough to be able to go through with the C-section tomorrow.
If Kristen delivers tomorrow, she'll be safe. But if her baby's lungs aren't ready, the delivery will be postponed and Kristen could get worse. It's a catch-22.
My concern is I want to have a normal birth. I want to get the baby out healthy, but before a big problem occurs. You thought we were going to be here till noon. That was quick.
Unless she thinks it's a good height.
Lisa Yore's doctor has decided he can't slow down her labor any longer.
The hard part about triplets isn't the delivery, but rather getting them to as far along as we've gotten. These days, 33 and a half, 34 weeks, we expect the babies to do well.
A little bit more.
Nevertheless, the OR is packed.
It's going to be a zoo. Whenever we have triplets, we have 4 people for each baby. So we usually have 2 anesthesiologists, at least 2 physicians scrubbed, a scrub technician, 2 or 3 nurses getting us what we need, documenting what we need.
3 babies is a lot of work.
Incision.
We're doing great. We're almost in. We're into the abdominal cavity already. Look at that, surf's up. Man, lots of fluid. This is the rapid weight loss program. We got a foot. We knew that.
And it looks
Stand
like
up.
we have a little boy.
Good, there's one.
One out.
Right here.
Okay. Well, this is it. We're
There it is.
blue cow.
Okay.
Hi, little
Thank
baby. Another boy.
All right, well, we got two. Hey, buddy, what you got to say for yourself?
Get them.
Lisa and Garth already knew that 2 of the babies were boys. The third, baby C, will be a surprise to everyone in the OR.
Ready?
While Lisa Yore's 2 baby boys struggle with their first few moments of life,
Just broke the water.
everyone in the OR is about to finally find out if baby C, the mystery baby, will also be a boy.
Finally got one turned the right way. This one's going to be a bit smaller than the others.
Oh, it's a girl. It's a girl.
Looks like a girl to me.
Hi.
Hi, sweetie. Happy birthday. I think we're done.
That's probably across.
3's enough, isn't it?
Did they say 2 boys and a girl?
Yeah.
They did.
That's the left, the one up top, just like you said.
Like
is a
I
girl.
said.
The one that hid the whole time.
Trouble, pure trouble.
The smallest.
Although doctors are concerned with respiratory problems, the babies so far look good.
Oh, God. I want to see them.
You'll see him soon enough.
Hang in there, sweetie. Hang in there.
Baby C, Keely, is the smallest.
C, 3'4".
Baby A, Luke, is the strongest and weighs 4 pounds, 5 ounces. But it's baby B, Bailey, who although weighs in the highest,
4 pounds, 6 ounces.
seems to be the sickest.
Even though he's probably the biggest, he's the one who's the most concerned right now.
Once stabilized, the babies are rushed to the NICU. Lisa only gets to see one, the sickly Bailey.
This is baby B. Love you. I can't believe we have 3 more children.
Baby B is a little bit in worse respiratory distress. And so he's been grunting like this ever since he was born, so it's about 20 minutes. As soon as we get him situated, he's going to need to be intubated.
Once in the NICU, doctors waste no time intubating Bailey. Keely is also starting to show signs of distress.
The little girl over here has started working a little bit harder to breathe, so we're going to try it in between with her and put her a tube in her nose and give her some airway pressure through that.
The next 24 hours are crucial. Only then will doctors be able to determine if the Yore triplets will ever have a chance at a normal, healthy life. Kristen Stewart's amnio results show that her baby isn't ready to be born yet. But that doesn't matter.
We're heading over to labor and delivery because I was spilling some protein in my urine and my blood pressures are a little bit higher than they're comfortable with. So we're probably going to deliver tonight.
What's your last name?
Stewart, S-T-E-W-A-R-T.
Kristen has transitioned from pregnancy-induced hypertension to preeclampsia, which puts her dangerously close to stroke or seizure.
Okay, you can have a seat for me right around the corner here to your right, and the nurse will be with you momentarily.
Okay, thanks.
Okay.
Okay.
Kristen's doctor was concerned enough to have her come in immediately.
But obviously I wasn't expecting that because I have my 2-year-old with me. Yeah, we're gonna bring it. Come with me.
Her precarious health situation is also being exacerbated by a winter cold and fever.
They said it wouldn't affect the surgery. They're just gonna go with it. It just affects me, so now I get to recover with a runny nose.
That's a little big on me. A bit strange.
With blood pressures reaching highs of 150/100, Kristen needs to deliver now. But it's a very busy night at Prentice Women's Hospital.
You're going to be delayed, actually, because there's 2 other sections that need to go now.
Oh, okay.
You're going to wear the stylish clothes for a little bit longer.
We're not postponing anything.
How about tomorrow?
No.
Now, I just came in to tell you they're finishing the first case, so you're next. So as soon as that patient's in the recovery room and they get the room cleaned, then they'll roll you back. And I am barring the door to keep anybody else from sneaking into the line ahead of you.
You need to relax a bit.
Yeah, you go through surgery and then you relax right before they take you in.
I think probably within 20 minutes or so. Okay. That's the hope here, okay?
It's emotionally draining regardless, even if it's a simple, they do everything by the book, it's still emotionally draining.
Tell me where you're going.
2 hours later, it's Kristen's turn.
The operating room to get this baby out.
All right. You ready?
Yes, I'm nervous, but I'm ready.
Okay, I'm gonna check you, okay? All right?
Allison Sirens is progressing quickly.
She's complete, and +3. Are you ready for the miracle?
A little dizzy before, so don't put me up too high.
Okay.
Allison's dizziness might be due to her blood pressure that seems to rise in a medical environment.
This is really great. Everything is perfect. The baby's good. Everything is just great.
It has no relationship to preeclampsia, but it does mean she has vascular instability, and a severely high blood pressure could result in a stroke.
Grab your knees a little. Give me a little. Oh, there's the head.
Deep breath in and push. Charge nurse for delivery. Okay. Hold your breath and push on your butt.
Okay, stop for a second. Stop, girl. Stop. Here comes that head. Here comes that head. You don't have to push. Look at all that beautiful dark hair. Push, push.
With Allison barely pushing, her baby gently navigates through the birth canal. The doctor allows the baby to take her sweet time for a reason.
There was no rush for that delivery. And in fact, there's a lot of importance in letting the placenta give that baby that little last bit of oxygen. That's why she pinked up right away. Because she's technically not born yet. You know, we tend to hurry, so we hurry and clamp the cord, and there's a lot of good things in that cord. Okay, give her a little maybe. You want to hold her?
Yeah.
See? Go, you can reach down.
He asked me if I wanted to pull her out, and I didn't think I would want to do that, but when I leaned up to do it, it was great. So I just pulled her out and put her on me. It was so nice.
Oh, honey, she's so perfect.
8 pounds even. Yeah, you're a big girl.
Kendall Lee Sirens is about as perfect as a newborn can be.
Oh, she looks beautiful. She's nice and pink. She's crying, so we know she's breathing well. Look at that color. That color tells it all. You are. Oh, her breathing sounds fine. It's a little fast, but it's very normal for right after delivery. Nothing alarming, but I think she still has a lot of fluid in there. So until we get her crying and let that absorb a little bit. Your eyes are
You like to be a little exhibitionist, huh?
Thank you. You're so pretty. Kendall, you're so pretty.
I mean, could she look any cuter? Look how cute she is.
Let me ask you, do you have any headache right now? Are you seeing any spots or anything like that?
25-year-old Dolores Clanton wasn't scheduled to be here for another month.
Everything was going great. Then all of a sudden, it just took a turn for the worse.
How much would you rate your pain right now?
It's about a 5.
A 5.
Last night, she was admitted to the hospital because of high blood pressure.
It was 140/100.
And now she has edema. Edema is fluid retention, common in the 3rd trimester. But severe edema could be a sign of toxemia, another name for preeclampsia.
Any headache, blurry vision, pain up in your belly? No. Can you squeeze my hands for me?
Doctors have decided to induce her labor, but it hasn't been easy.
Good strength.
Dolores gave birth to a daughter 5 years ago.
And my baby's heart rate was going down, so they gave me an emergency C-section.
Pick up a little bit for me? Great.
She wants to deliver this baby naturally. It's called a VBAC, vaginal birth after C-section, and it's risky.
Risks of a vaginal trial of labor is possible uterine rupture. You can't predict who might rupture.
You made great progress.
Uterine rupture occurs because the uterus has been cut once before, and it's weaker. As her pregnancy grows, the uterus thins out, and it's particularly vulnerable around the surgical scar.
This area is more likely to rip as her pregnancy progresses, and then as the uterus starts contracting, you're getting a lot of forces on that weakened spot, which can rupture. And if your uterus ruptures, you could bleed extensively, you could need a hysterectomy, your baby could die.
We're gonna start Pitocin, and that's just gonna help her contractions.
Delion Bridges is 34 weeks pregnant. Her baby is already vulnerable for respiratory distress syndrome and will likely spend the first few weeks of life in the NICU.
So on a pain scale of 0 to 10, how would you rate that pain? A 10? A 10 out of 10? Okay.
But right now, this mother, who has already suffered the loss of 2 babies, wants to get him out of her womb and into her arms as soon as possible.
So I know you're just gonna have to kind of breathe through them for right now. We're not completely dilated yet. We can't wait either.
Delion Bridges is at 9 centimeters.
Please, somebody, please, hurry up, please.
This is on its way, okay?
And she's getting little relief from her epidural.
God, it hurts so bad.
Dylan, listen to me. I want you to breathe. No, deep breath in, deep breath in.
Her baby is a month early and will need extra medical support once he's delivered.
Slow and deep. Good, slow and deep.
And he's about to be delivered any minute.
Complete. She should deliver shortly, especially because she's feeling all this pressure. Is it a constant?
Delion Bridges, who has suffered so much loss as a young mother, is pinning her hopes on this special delivery.
You just had a contraction.
Although this is Dolores Clanton's second baby, this type of labor is unfamiliar to the young mother.
Your baby's head came down nicely. You are about 9 centimeters dilated. There's just a little bit of cervix.
Because her last child was born by C-section.
Are you having contraction right now? Yeah. Hey, hang in there.
Women who have a vaginal delivery after C-section can suffer the risk of uterine rupture.
At the next one, as soon as you start to feel it, let us know, okay?
And right now, during this stage of Dolores's labor, her doctors are trying to see if her weakened uterus will survive the delivery.
She's progressed to 9.5 centimeters, so she's doing well. Her uterus is holding strong thus far, but we'll keep a close eye on that.
Push down hard.
1, 2, 3.
At this stage of labor, anything can happen.
If, worst case scenario, her uterus actually ruptured at some point during this labor, we would proceed with an emergency C-section.
Oh, it's right there. Okay, no, call Dr. Sokol. Let's break down the bed.
After waiting all day for her scheduled C-section, Kristen Stewart is about to have her epidural when, all of a sudden,
Is to stay sitting straight
I'm
up.
feeling weird right now.
she's hit by a sudden panic attack.
What kind of weird?
I'm feeling a little bit weird. I don't know.
Any taste in your mouth?
No, I'm just feeling weird.
We didn't get that much.
Okay.
You know what? It's probably because you're nervous. That's normal.
No, it's not that. It's not nervous.
Can you be any more specific?
I feel
Dizzy?
kind of.
Kristen is having a reaction to the numbing medicine.
We'll take a few seconds and it'll go away.
Cindy, can we get a Kleenex for her?
I tried making bring that all
But I can feel you doing that. Is that okay?
With her epidural in place, Kristen is feeling a little better, but now her blood pressure is spiking.
Her blood pressure is, she's running diastolics consistently around 110, 105 to 110.
Oh, it's gone up since you got here. Miss Stewart, how you feeling?
Where's my husband?
He's coming.
You okay? You're doing okay.
Did we test?
You're doing great. I'm right here. How you feeling?
I feel okay. I just want it done.
Okay.
Decision.
To stabilize her blood pressure, doctors need to deliver this baby now.
We're not having too much of a trouble with scar tissue so far. There's your blood pressure reading now. It's perfect. Just trying to figure out the best way in. You're fine. All right, let's go down. Doing good. We are ready to go through the lining of the uterus. We got a moving target here. Here comes the head. Holy cow!
Is he out?
The head is out.
Dad,
if you want to stand
I can't tell
up
if
and
it's
take
a
a look. Here's the shoulders.
Oh my Lord!
It's definitely a boy. It's definitely a boy.
At 6 pounds, 10 ounces, William Stewart IV is a good-sized baby. But he's having some trouble.
So the breathing he's doing, that sounds like it's crying, is actually him just trying to get his lungs open a little bit. Tests they did on Mom's showed that his lungs were just about ready, but we're not really quite sure. So we're going to try to get him to open those up for us so that...
Will is given some positive airflow pressure to help open up the lungs, but he needs help transitioning from the womb to the real world. He will be spending his first night of life in the NICU.
Yeah, I think she's kind of anxious to see him.
Come on, Will.
But not until he says hello to Mom.
Now give Mom a smooch. I'm putting you back under the heat, fella.
Who has a special request.
Can I see his boy part?
Oh, sure. You can see whatever you want.
That's my wife.
Okay.
Born 6 weeks before their due date, the Your triplets are spending their first day of life in the NICU. Under the watchful eyes and careful hands of the pediatric staff. So far, baby A, Luke, is faring the best.
He's been doing great. Since he's been down, he's been doing all the breathing on his own. And so respiratory-wise, he's doing really, really well. He's actually just at a point where he's a baby that we would call a feeder and grower.
When she came to the NICU, Keely needed a nasal tube to provide air pressure into her lungs.
She was on that for about 10 hours. And this morning, she was doing so well that we pulled that tube out, and since then she's been breathing all on her own and looking very comfortable and nice and pink, and she looks good. You have to let go. It's okay.
But baby Bailey isn't doing as well as his brother and sister.
Out of the triplets, Bailey right now is requiring the most assistance from us. He's still on a ventilator, so he is actually starting to come down on the amount of support that we're giving him, but he is still requiring some help with his breathing at this point.
The first 24 hours are crucial for babies in the NICU.
Sometimes they'll basically forget to breathe, and sometimes then we'll also start to see their heart rate slow a little bit, which is why all our babies here are always on monitors.
And because of their young age, sucking, swallowing, breathing, and feeding by mouth will be major milestones in their development. Another milestone, meeting their mom for the very first time. While nurses in the NICU try to help baby Will Stewart breathe more comfortably, his mother, barely recovered from her C-section, insists on seeing him.
See, I'm crying and I don't even know why.
Tonight, she gets to visit him briefly in the NICU.
How's he doing?
Well, he's
doing a little bit better than he was in the delivery room. You know, with the extra tube in his nose and some extra oxygen, he seems to be really feeling a little bit better.
Although Will was almost term, 37 weeks, his lungs were still underdeveloped.
We'll just have to watch him and see whether this is just going to be some extra fluid in his lungs that then just, you know, gets better on its own, or whether he really does have some immaturity in his lungs.
Immature lungs can result in respiratory distress, which can affect him in the long term.
I just hope he doesn't have to spend too much time here.
Waiting an extra day to deliver might have made a difference, but there really was no alternative.
We were a little bit disappointed, but we want what's best for him, and regardless, they said I was in early stages of preeclampsia and I would rather deliver before it got bad. So it's better off for him and for me, for him to have been delivered. He won't be here that long. If he's anything like his dad, he's a fighter.
Only 34 weeks pregnant, DeLeon Bridges is about to give birth. With her history of preterm labor, it's impossible to keep DeLeon pregnant to term.
Slow down. Come on, you have to breathe. You have to breathe. Blow it out. Blow it out like a candle.
So doctors are letting nature take its course.
Dr. Sue say it's time for a baby, okay? That's why, see, we had to do this before Dr. Marcus could give you any pain medicine, because he don't want to give it.
It's hurting.
I know.
It's hurting.
Lift your butt. Blow hard, blow hard. No talking, just blow.
So when you feel like you have to push and you feel like you have that feeling that you need to go, you're gonna hold your legs back, okay?
Chin your chest and push. Hold your breath in. Deep breath in and push. 1, 2, 3, 4, 5, 6, 7. Now, hold your breath. You're doing fine. Stop, don't push, don't push. You're doing it. You're doing it. Where's your baby? Did you know you were going to have a baby boy?
Because of the baby's premature state, the neonatologist is standing by.
We're just stimulating the baby. We're just drying him off and suctioning out his mouth and getting him to open up his lungs on his first breath.
See how much you weigh, Peanut, huh?
The baby is big for a 34-weeker.
4 pounds, 10 ounces.
But there's no way he can spend the night in his mom's room. He still has fluid in his lungs.
If he was 4 weeks older and a kilo more, you could chance it.
Your little baby boy.
He's having a little trouble breathing, so we're gonna take him downstairs and watch him down there, but he looks really good. Happy birthday.
Instead, he'll be spending the first few days of his new life in the NICU.
This is little Kendall Lee. She's 2 days old now. She did great. We're having some digestive problems, but we'll fix that at home.
Kendall Lee is perfectly healthy, and so is Allison, now that she's being discharged.
Ready for all the hard work that's about to occur, I think. So much for sleep-filled nights.
Time to go home.
And now that she is on her way home,
Bye.
What a cutie.
Allison's white coat hypertension is gone. Right now, the only thing raising her blood pressure is the sheer excitement of welcoming a new special delivery into her life.
We're headed down to the NICU, see the kids.
The 2-day-old Your triplets are finally getting a visit from their mom.
I don't know where to go first.
Baby Luke is doing well. And his sister Keely is basking in the glow of phototherapy to treat her jaundice, a common condition in newborns.
Getting a suntan.
But it's baby Bailey who is causing the most worry in the NICU. Since his breathing tube was removed, he's been having trouble.
Vein boy over there.
And now Bailey's kind of not saturating as great as I'd like him to, so I'm just giving him a little bit more oxygen and suctioning out his tube and just trying to get him repositioned and comfortable and all of that.
But his breathing is getting worse and worse. It's time to let his parents know what the options are.
So you see his a little thing in his chest looks like a golf divot. So once you watch that and the little shape of his ribs to indicate how hard they're working to breathe. Ever since his breathing tube got pulled out, he's been on and off doing this, but it's about as much as he's been doing it in a while. So what we're probably going to do is maybe try changing his position a little bit. That sometimes works. And get an x-ray too, just to make sure that he doesn't have any part of his lung that's collapsed, because sometimes when they have to do it on their own, they can do that. Yeah. If this keeps up and those two things are not real fruitful, and he stays on this much oxygen, he's probably going to need his breathing tube back in.
Right.
So he's gradually showing that he still has enough respiratory distress and he's not kind of getting over it on his own.
And from there, the prognosis isn't good.
What'll happen is he'll tire out, and if he tires out, then he won't breathe as hard and deeply as fast as he needs to be. And then the oxygen exchange and his ventilation will go downhill relatively quickly because he's kind of pooped out.
I'd rather have him put it back in than have him work this hard. Yeah, he's not ready.
Lisa and Garth realize that there is no choice. If baby Bailey doesn't go on a ventilator soon, he could stop breathing and die.
I'm about to go downstairs to the nursery and see my baby and make sure everything's okay.
DeLeon Bridges is no stranger to the NICU, but going there is still an unnerving experience. Especially with a premature infant who's having trouble breathing.
You hear that noise he's making? It's called grunting. It's just kind of transitional breathing, kind of his lungs trying to work for him. In order for us to help him with that, we've got this tube in his nose, which gives him some pressure to his lungs to assist him, and also gives him a little bit of oxygen, which actually he's not requiring any additional oxygen right now. So just a little pressure for his lungs to help him transition.
It's a particularly bittersweet moment for this young mother who has had 2 tragic losses.
I wanted to hold him, but...
All right, now you can touch him. Do you want to put your hand in there? Yeah?
I think he's gonna be okay.
Any indication as to when they might leave? Or any of them might leave?
That I couldn't tell you. They definitely have, steps ahead of them.
Today, Garth Yore checks in with his babies in the NICU, while his wife Lisa checks out of the hospital.
Hey there. Nice.
The babies won't be going home for a while. Born 7 weeks early, they still have a long way to go. But Luke, the oldest, is surprising everyone with his progress.
He's eating well, and he's bottle feeding, which is great news for us. All 3 of them, he seems to be the most at peace right now, so we're hopeful.
Bailey, whose respiratory distress had taken a turn for the worse, had doctors concerned. They wanted to put his breathing tube back in.
We ended up holding off on that, kept him on the CPAP, just on a little bit higher oxygen that he was requiring at the time. And throughout yesterday and then overnight last night, we've started to see an improvement again. He's kind of turned the corner and he's doing a lot better with his breathing.
As she prepares to say goodbye to Keely, Lisa is shocked by what she sees. Keely's IV is threaded through her scalp, common procedure for most preemies, but still rather upsetting to a new mother.
I know it's not the easiest thing
Yeah,
to see. It's really just a matter of we run out of sites after a while, and they do have nice big veins in their head. We try to save it as a last resort, but it is also actually a really good place to access if we have to. So I know I wish we could have warned you before you came in. Usually we try to kind of give you a
where's our
heads
hat?
up. Yeah.
You know, every time I walk in, it's something different. Leaving is hard, but I know they need to be here, so that wasn't as hard as seeing a new needle and something else that, you know, looks like it hurts her, but, you know, I guess that's all part of it.
Okay, sweetie, here we go.
As the Yores gather up their toddler and head home, the reality of their multiple expanded family is becoming clear.
We bought a new car to fit 4 car seats, one for our 2-year-old, and then the 3 other car seats. We refinanced our house to pay for it all. And a lot of little, borrowing cribs and borrowing bassinets and clothing and things like that, so.
And those empty car seats are a constant reminder that Garth and Lisa are about to fill their lives with 3 special deliveries.
We are so looking forward to just having them at home and holding them, and it's hard to even just get a good look at them, so we can't wait to do that. The little things, you know, feed them and hold them and just give them a lot of love.
This is William Hale Stewart IV. He's gonna go by Will.
3-day-old Will Stewart is going home.
With a 2-year-old and a newborn, I don't anticipate too much time to myself over the next couple of months, but I'm sure it'll be rewarding.
Despite a slight initial case of respiratory distress, Will is doing just fine. And now that his mother is no longer pregnant, she is no longer in danger of hypertension.
Give him a gentle kiss. I'm glad to have him in my arms instead of in my belly worrying about preeclampsia. So.
For Kristen and Bill Stewart, a pregnancy that began with a life-threatening scare has ended with a beautiful and special delivery. Today, baby Bridges finally has a name, thanks to his Aunt Renee.
My sister named him. I didn't have a name, so I let her name him. His name is Brandon.
I named him Brandon because it was a name that fitted him, and his middle name is Omarion.
Brandon Omarion Bridges is struggling. Born at 34 weeks, he is vulnerable to respiratory distress and infection. This morning, doctors had to put a tube down his throat, which will hopefully increase his lung capacity. The goal is to take Brandon off the ventilator within a couple of days.
Even though it's keeping him, saving him and helping him, it also can cause some trauma, so we don't want to have that in any longer than we need to.
Every day is a milestone for a newborn, but every hour can be a milestone or a setback for a preemie.
Thanks, Michelle.
You're welcome.
Dolores Clanton is about to give birth vaginally for the first time.
Take a deep breath in and push really hard. 1, 2,
Good.
5 years ago, her first baby was born via C-section.
Okay, let it out. Take a deep breath.
Right back at it. Here we go.
Push again.
Unfortunately, there is some concern that the scar tissue can tear, her uterus can rupture, and she could bleed uncontrollably.
10. Great. Okay, let's keep your legs up. Take a deep breath in and push really hard. 1, 2, 3.
So doctors are monitoring this birth very carefully. Right now, every excruciating second counts.
Breathe.
Oh, Lord.
You're doing great. Tuck that chin to chest, push down hard in your bottom. Good.
Good,
2,
good.
3.
The baby was so close to delivery that if she had ruptured, it'd be very, if she couldn't push the baby out, we could easily put on forceps and deliver the baby.
Slow down, slow down, slow down, slow down.
Okay.
Slow down. Okay, stop, please. Stop.
Great. He's excited to meet you.
Leo.
Born a month early, the baby is small, weighing 4 pounds 3 ounces. But he's healthy. And finally, his mother is also out of danger.
You know what? He's very comfortable breathing. That's the main thing that we worry about, making sure that he's nice and perfused and keeping his heart rate up.
6 minutes into his new life, he seems to be adjusting.
He really is doing quite well at this time. As you can see, he's eyes wide open, looking around, no labored breathing, not grunting, not retracting, very regularly moving air. It appears to us right now that the baby can safely stay in the room with mom.
And that's great news for mom,
He's really tiny.
Hey, he's so little.
who has already picked out a big name for her tiny special delivery, Jahari Deshawn Woodard.
That's a big name to live up to, but I'm sure you're gonna do it. You have a world of possibilities ahead of you. Everything's open. World of possibilities. This could be the next president of the United States.
Brandon Bridges is almost a week old, and already he's defying the odds.
Brandon is doing very, very good. He's not on any breathing tubes. He is eating from the bottle. Hopefully, he'll be home soon.
Brandon was on oxygen support, but not for long.
But since the CPAP came off today, he pulled out his tube because he was crazy, you know, crying, wanting to eat. So we gave him the bottle and he actually took it all. And for his age, sometimes they do, sometimes they don't, so he's doing pretty good. That's a good sign. It means they're probably feeling better and telling you that they don't think they need that anymore. And help me, give me a try, let me do it without it.
He's doing so well, in fact, that he may not have to stay in the NICU until his due date, 3 more weeks.
If he continues to eat like he's eating and get off the phototherapy lights for the jaundice, I don't know, maybe by the end of the week or the weekend.
For Delion, who suffered the devastating loss of 2 babies, and might have lost this one too, Brandon is a blessing.
It was hard, harder than the last times, but he worth it.
All the uncertainty, the pain, the fear of a high-risk pregnancy. Certainly worth it once a mother stares into the innocent and remarkable face of her very own special delivery.